Hello, friends. Welcome. I am Dr. Harvinder Singh. Welcome to our next video podcast. Actually, this video podcast will be our video number 30 on our YouTube channel and course chapter number 228. Today, I'm actually starting this new lecture series. It's called Basic Mechanism of Actions for Antidepressants. Many of you know that this course that I created, Physician's Guide for Clinical Psychiatry course, have 18 different sections. One of the section is called Back to Basics. I created this section mainly for early career psychiatrists or anyone who is interested in learning the basics of psychiatry, and I have kept this section free for everyone. And this lecture series will be a part of this Back to Basic section of this course. This lecture is a three video lecture. I'm posting the first video today, and the main topics that I will discuss in these series are today we will discuss basics of serotonin, how it's formed, pathways, receptors, and other profile. The second lecture will be on mechanism of actions for SSRI, SNRI, NDRIs, tricyclic antidepressants, and MAOIs. And the third and last will talk about all other antidepressant class. Um, if you're interested in learning the schedule, please click on this link. I think it will show somewhere here. It will show you exact schedule of when these lectures will be posted. So let's begin this lecture series today. So let's begin our discussion of this Back to Basic series with focus on antidepressants, mechanism of action. As I discussed, these are the three video chapters that I will talk about. Today we are starting with the first one, which is serotonin, basics, and beyond. Here I will talk about mainly pre-synaptic and postsynaptic neurons, mainly how serotonin is synthesized in presynaptic neuron, what receptors are there on pre and postsynaptic neuron, what are the serotonin pathways, and how receptors play a role, and last, very brief overview of how 1A and 2A serotonin receptors are different. So let's begin with the serotonin synthesis. But before I do that, I just want to spend some time regarding history of serotonin. Well, we know that serotonin was first isolated in 1940s, and later they found in 1950s that it does exist in human brain. And then they found association of LSD with increased serotonin levels, and later on they found association of serotonin with mood regulation. And how they found this was this drug called reserpine, which depletes serotonin level in brain, was associated with inducing depressed mood in individuals. And later on, the monoamine oxidase inhibitors, tricyclic antidepressants, association with high serotonin, and improvement in depressed state was noted. So this is a very brief history of serotonin, but let's focus on this diagram that I created. So we know that the neurons in our brain, they talk to each other through neurotransmitters. We have many neurotransmitters in our brain: serotonin, dopamine, norepinephrine, acetylcholine, and many others. In this diagram, you see that there are two neurons. On the left side, there is serotonin neuron. On the right side, there is norepinephrine or dopamine neuron. we all know in reality they don't exist like this. We have separate serotonin neuron, separate norepinephrine neuron, separate dopamine neuron. Well, I created this to make this video lectures more simple and easy to understand. In our video lecture number 2 and 3, you will see the benefit of this diagram. But for now, let's focus on only serotonin neuron. Like, how is serotonin formed in serotonin neuron? So let's begin with this main chemical called tryptophan. Tryptophan is a main precursor of serotonin formation. Tryptophan is transported into the presynaptic neuron through this transporter, and through these enzymes, tryptophan hydroxylase, 5-HTP decarboxylase, tryptophan is gradually converted into serotonin. Now, the interesting thing is when serotonin or even dopamine or norepinephrine is formed, for them to survive in the presynaptic neuron, they need to be packaged into these vesicles. If they're outside, they will be destroyed, like by enzyme called MAO, monoamine oxidase, which is a natural way of natural way of controlling the amount of serotonin within presynaptic neuron. So if the one pathway is that this will get destroyed, the other pathway is the vesicles go down and they fuses with the membrane, thereby releasing all the serotonin into synapse. Synapse is an area between pre and postsynaptic neuron, very important area. Now, what happens is when serotonin is released into the synapse, it will go into many directions. First is it will go down and act on the receptors on a postsynaptic neuron, and second is the reuptake transporter, which is another nature's way of controlling the amount of serotonin in synapse. Excess serotonin is taken back through this transporter back into the presynapse. Now, let me actually go back a little bit. Now, this is the basic pathway of how serotonin is formed. And this pathway is very, very important in understanding why we use certain antidepressants. If any of this pathway is affected, like there's a less availability of tryptophan, or any of the enzyme is not working that efficiently, or MAO is acting more aggressively and destroying most of the serotonin before it fuses to the membrane, or serotonin transporter is more active or taking these serotonin back into the presynapse. Even on a postsynaptic neuron, if there are any issues with the receptor profile, low serotonin state will happen. So we need to be very mindful of these. So this is a very basic overview of how serotonin is formed. Now let's talk about both pre and postsynaptic neuron. So you see we talked about presynaptic neuron on top, below is the postsynaptic neuron, and there are many receptors on it. I will say just ignore that arrows that I have written there. We'll talk about that in a few minutes. But focus on the numbers. So you see 1A, 2A, 2C, 3. These are the serotonin receptor subtypes. And I think in mammalian brain, there are at least 14 different serotonin receptor subtype. But here we will only focus on these for now. These are very important in psychiatry and also on the action of antidepressant. Now, before we move forward, also notice that there are some receptors on a presynaptic neuron also. 5-HT1A and alpha-2. These are autoreceptors. What that means is if serotonin attaches to serotonin 1A presynaptic receptor, it will act as a brake. It will reduce the flow of serotonin down from presynaptic neuron to postsynaptic neuron. Same way goes for the alpha-2 receptors. We will talk more about these in, I think, video number 2 and video number 3. So what I'm trying to say here is we have receptors on presynaptic neuron and postsynaptic neuron. Now, let's focus more on a postsynaptic neuron now. Um, we all know that each neuron have a pathway. Like dopamine have four important tracts that we know, where antipsychotic works and causes positive and negative side effects. Same thing happens to serotonin pathways. So let's talk about this for now. So the most important center where these pathways or serotonin projection start is this nucleus in brainstem called Raphe nucleus. This is a main originating center for serotonin neurons. And these pathways, you see how they go and act on the postsynaptic neurons, and there are certain receptors, serotonin receptors, written in green. And this is what we'll talk about. And if you understand this correctly, you will know the side effect profile of antidepressant and even beneficial effect of antidepressant. So let's start with the first projection, which is, I think, the most important projection to the frontal cortex. This projection is responsible for improvement in mood, improvement in depression. You see 1A and 2A written there. I will talk about this briefly in the next slide once we are done with the projections. But be mindful, this projection to frontal cortex is responsible for the antidepressant benefit of your medication. Rest of these projections are responsible for a side effect profile, I should say. Now, this was our first projection. The second projection is to the limbic area. Now, again, 1A is there, 2A is there, 2C is here. The basic result of this pathway is effect on anxiety, panic attack, and irritability and agitation. Now, serotonin 2A receptor agonism is known to cause high anxiety. And how we know that? Well, these drugs called LSD, psilocybin, they are serotonin 2A receptor agonist. And patients in acute intoxicated states reports very high level of anxiety. And same way goes to studies done in a knockout mice models where serotonin 2A receptor was removed. Those studies shows marked reduction in anxiety levels. So very important role of serotonin 2A receptor with anxiety. So lesson to learn here is, if you give serotonin 2A antagonist, you will have benefit with anxiety. Now, we will talk about depression in the end. Now let's move on to our third projection, which is to basal ganglia. Here again, serotonin 2A is implicated. You will notice the importance of serotonin 2A. Now, serotonin 2A projection here on basal ganglia is responsible for the obsession and compulsion aspect. And also, this is responsible for abnormal movements through the basal ganglia projection. Now, moving on to the third one, which is hypothalamus. Well, this projection to the sleep center of hypothalamus is responsible for insomnia or increased sleep. So again, if you give serotonin 2A antagonist, they will show improvement in insomnia. So one more benefit of antagonizing serotonin 2A receptors here. Now, moving to our next projection, which is down to spinal cord, which actually affects your spinal reflexes and is responsible for sexual side effect of antidepressants. Again, if a medication have serotonin 2A antagonist property, it will have beneficial effect with less or no sexual side effect profile. We'll talk about that in again video lecture number 2 and 3. Now the next projection is to the satiety center of hypothalamus, which actually controls the appetite, and the receptor involved here is serotonin 2C receptor. So far we have talked about 2A. 2C have some effect on the anxiety limbic system that we talk about, but more prominent effect is on the appetite. Because we know this medication called lorcaserin, which is a selective 2C agonist, is a very well-known anti-obesity agent. Because agonism, we are not talking antagonism now, agonism of 2C receptor will reduce the appetite. And opposite effect happens. We have certain antidepressant that antagonizes 2C receptor here, thereby increases appetite and can cause weight gain. We'll talk about that also in next video lecture. Now the last projection is to this area in our brainstem called chemoreceptor trigger zone, specifically serotonin 3 receptor here, which is responsible for nausea, vomiting, and GI motility. So if you block this receptor, you will have beneficial effect on that. Again, certain antidepressants do that. Well, these are the basic overview of projection, but it's not that simple. We have more receptors, and these receptors can change also in terms of their location, amount, based on a normal state and a stress state. But I'm not going to go into that. I'm going to end this session with the last topic, which is how are 1A serotonin receptor and 2A receptor implicated in depression improvement. Well, the basic overview here is serotonin 2A dominates in cortical area and 1A dominates in the limbic circuit. So we all know the limbic circuit is important in the anxiety aspect that we talk about. The cortical projections are more responsible for depression, right? So the basic overview is that in a normal condition, serotonin 2A, the one in red, dominates and inhibits serotonin 1A. Serotonin 1A signaling is very important for serotonergic medication functioning. Actually, let me see if I can go to the next one here. So you see serotonin 1A and 2A down on a postsynaptic neuron. This interaction is very, very important. So when you give antidepressant, they take 3 to 4 weeks or 2 to 3 weeks in some cases for onset of response, because 2A have a negative effect on depression. 1A have a positive effect on depression. It takes medication 2 weeks, 3 weeks to downregulate serotonin 2A receptor, and thereby it reduces the inhibition on 1A serotonin subtype, and then it increases your improvement in depression. So think about it. If you have a serotonin 2A antagonist, you will not only block this but also reduce the inhibition on 1A, thereby improving the efficacy of antidepressant. To make it more confusing, I will just say one more thing here. Now, they also, I have mentioned all the references in the end. If you're interested, you can read them. A few of them are available for free preview. Now, they also mentioned that in a normal condition with no stress, serotonin 1A dominates. But when there are increased adversity, increased stress, serotonin 2A dominates. So this is a very basic overview. You can also look down for more details, but these are the basic references that I looked at. So this was the end of this lecture. This lecture chapter is available on our website, Psychiatry Education Forum. It's available on our YouTube channel, so please do subscribe if you have not done already. And last but not least, our course, Physician's Guide for Clinical Psychiatry course. This is available and I have kept this series free for everybody. Actually, I am working on many of these lecture series right now. We have already one ongoing for our course subscribers. It's actually about a bipolar disorder guidelines review. We are almost about to finish that lecture series, and then we will begin a new lecture series on augmentation strategy for antidepressant. And there are many more things that are going to happen in near future for course subscribers. So if you have not already done, please do subscribe to the course. Very helpful, very clinically relevant. And also to keep updated of what I post on the website, about new video on YouTube or a new chapter in the course, the best way to stay up to date is by joining our email newsletter. I will put all the links below in the information section of this video. Please do click join the email newsletter if you have not already done so. So thank you, friend. This was our first video lecture in this lecture series. This is my email. Do not hesitate. Contact me if you have any questions or anything you want to share. Love to hear from all of you. So thank you again. You all have a good day. Take care. Bye.